stop what you're doing right now. Because what you're about to hear came directly from a urologist with over 25 years of clinical experience. And it involves two ingredients that are probably sitting in your home right now: castor oil, baking soda. That's it. No prescription, no expensive treatment, no waiting rooms. Just two things, 10 minutes, and results that have people completely shocked. Now, before you roll your eyes and think this is just another internet trick, I want you to stay with me. Because by the time this video is done, you're going to understand exactly why this works, what it does to your body, and how to do it correctly. And I promise you, the people who stick around to the end of this video are always the ones who come back and say, "I can't believe I didn't know this sooner." So let's get into it. Let's start with a question. Why would a urologist, someone who spent years in medical school, who runs a practice, who sees patients every single day, why would that person point to two kitchen ingredients and say, "This works"? That's exactly what happened. Dr. James Pendleton, a urologist based out of a private practice in the Midwest, was speaking at a small medical wellness conference a few years ago. It wasn't a huge event, maybe a couple hundred people in the room. He wasn't expecting it to go anywhere beyond that conference. But someone recorded it, and that recording spread. Because what he said stopped people cold. He said, and I'm paraphrasing here, "We spend so much time and money chasing complex solutions to problems that have very simple biological answers. Inflammation is one of the biggest drivers of urological discomfort that I see in my practice. And some of the most effective anti-inflammatory agents aren't in a pharmacy. They're in a kitchen." And then he talked about castor oil and baking soda. Now here's what's important to understand. He wasn't saying throw away your medication. He wasn't saying never see a doctor. He was saying that for a specific category of discomfort, surface-level inflammation, skin-related issues around sensitive areas, swelling, irritation, this combination, applied correctly, does something remarkable. And he had patients who had been using it quietly for years with consistent results. So what exactly is happening when you mix these two things? Let's break it down. Let's talk about castor oil first. Castor oil comes from the seeds of the Ricinus communis plant. It has been used for thousands of years, in ancient Egypt, in Ayurvedic medicine, in traditional remedies across dozens of cultures. But here's what modern science has confirmed about it. The primary active compound in castor oil is something called ricinoleic acid. This fatty acid makes up about 90% of castor oil's composition. And ricinoleic acid has been studied extensively for its anti-inflammatory properties. When applied topically, meaning on the skin, ricinoleic acid penetrates the upper layers of tissue and begins interacting with pain receptors. Specifically, it interacts with what are called EP3 receptors, prostaglandin receptors that play a direct role in inflammation and pain signaling. In simpler terms, it tells your body to calm down the inflammatory response in that area. Studies published in peer-reviewed journals have shown that topical application of castor oil reduces swelling, reduces redness, and significantly decreases localized pain, particularly in areas where inflammation is chronic or recurring. Now let's talk about baking soda. Baking soda, sodium bicarbonate, is something most people only think about when they're baking or trying to unclog a drain. But its biological properties are fascinating. Sodium bicarbonate is alkaline. It has a pH of around 9, and here's why that matters. Many types of inflammation, irritation, and bacterial or fungal discomfort are driven by an acidic environment. The skin around sensitive areas, particularly in the lower body, can become acidic due to sweat, clothing friction, pH imbalance, and other factors. That acidity creates an environment where inflammation thrives. When you introduce an alkaline substance like baking soda, it neutralizes that acidity. It rebalances the pH of the surface area. And in doing so, it removes one of the primary conditions that allows irritation and inflammation to persist. There's also research suggesting that sodium bicarbonate has mild antimicrobial properties, meaning it creates an environment that's less hospitable to the bacteria and fungi that can contribute to skin-level urological discomfort. Now here's where it gets interesting. When you combine castor oil and baking soda, you're not just getting two separate effects, you're creating a synergistic reaction. The castor oil acts as a carrier. It's thick, it's penetrating, and it draws the baking soda into closer contact with the skin. The baking soda neutralizes the acidic environment, while the ricinoleic acid in the castor oil begins suppressing the inflammatory response simultaneously. The result is a two-front attack on inflammation, one addressing the environment, one addressing the biological response, and that's why 10 minutes is the key window. Within 10 minutes of application, the combination has done its primary work on the surface tissue. You don't need hours. You don't need to leave it on overnight. 10 minutes is the window that urologists and practitioners who use this method consistently point to. Now let's talk about what specific conditions or situations this is actually being used for. Because this isn't a one-size-fits-all cure. It has a specific zone of effectiveness. Scrotal or groin area irritation and inflammation. This is the most commonly cited application. Men who experience recurring discomfort, swelling, or irritation in this area, often due to friction, heat, or chronic low-grade inflammation, have reported significant relief with consistent use of this combination. Skin tags and growths in sensitive areas. This is one that surprises people the most. Castor oil has a long history of use in dissolving or reducing benign skin tags. When combined with baking soda, many practitioners and patients report that small skin tags in the groin or scrotal area begin to dry out, shrink, and eventually disappear with repeated application over several weeks. This is not an overnight result, but it is a consistent one. Post-infection residual inflammation. After a urinary tract infection or a mild skin infection in the lower body area, inflammation can linger long after the infection itself is gone. The combination of castor oil and baking soda has been used to address this residual inflammation and speed up the return to comfort. Razor irritation and folliculitis. Men who shave the groin or scrotal area sometimes deal with folliculitis, inflamed hair follicles, or persistent razor burn. This combination soothes the follicles, reduces the inflammatory response, and helps prevent the cycle of recurring irritation. Cyst discomfort. Sebaceous cysts, small benign cysts that form under the skin, are relatively common in the scrotal area. While this combination won't eliminate a cyst entirely, many people use it to manage the inflammation and discomfort around cysts between medical appointments. In every one of these cases, the mechanism is the same. You're reducing inflammation, you're rebalancing pH, you're giving the tissue the biological conditions it needs to recover. Now let's get into the actual process, because doing this correctly matters. The ratio matters, the application matters, and knowing what to avoid matters. What you need: pure castor oil, cold-pressed if possible. You want the highest quality you can find, hexane-free, unrefined. This ensures you're getting the full concentration of ricinoleic acid without chemical interference. Baking soda. Standard sodium bicarbonate. Nothing fancy. Generic brands work perfectly. A clean cloth or cotton pad. That's it. The ratio. This is where most people get it wrong when they find this online. They either use too much baking soda, which can be abrasive to sensitive skin, or too little castor oil, which prevents proper penetration. The correct ratio is approximately 2 parts castor oil to 1 part baking soda. So if you're using 2 teaspoons of castor oil, you're using 1 teaspoon of baking soda. Mix them together until you get a consistent paste. It should be thick but spreadable, not watery, not clumpy. The application. Clean the area first. Gently wash with warm water and pat dry. You want the skin to be clean and slightly warm because warmth opens the pores and allows better absorption. Apply the paste gently to the affected area. Do not rub aggressively. Use your fingertips or a cotton pad and apply in slow, circular motions until the area is evenly covered. Then, and this is important, let it sit for exactly 10 minutes. Set a timer. Don't rush it. Don't leave it on longer thinking more time means better results. The 10-minute window is where the active compounds are doing their work. After that point, the mixture has done what it's going to do on the surface. After 10 minutes, gently wipe away the paste with a warm, damp cloth. Do not scrub. Pat the area dry afterward. Frequency. For general inflammation and irritation, once daily for 1 to 2 weeks is the typical recommendation. For skin tags specifically, once to twice daily for 4 to 8 weeks. What to avoid. Do not apply this to broken skin or open wounds. Do not use if you have a known allergy to castor oil. Do not mix with any other substances. No essential oils, no other compounds. Keep the formulation simple. And of course, if you are dealing with a condition that has been diagnosed by a physician, do not replace your prescribed treatment with this. Use it as a complementary approach and discuss it with your doctor. Here's what people report after consistent use. Within the first 2 to 3 days, most people notice a reduction in surface-level irritation. The area feels calmer, less reactive. If there was visible redness, it begins to fade. By the end of the first week, swelling, where present, is noticeably reduced. Discomfort that was chronic begins to feel intermittent, and then, eventually, absent. For skin tags, the timeline is longer, but around the 3 to 4 week mark, people begin to notice the skin tag darkening, drying at the base and beginning to shrink. By 6 to 8 weeks, many report complete resolution. These aren't dramatic overnight transformations. This is biology working at its natural pace, but working consistently, without side effects, without cost, and without complexity. That's the part that urologists like Dr. Pendleton find compelling. Not that it's miraculous, but that it's consistent, accessible, and based on sound biological principles. Here's what I want you to take away from this. Your body is always trying to heal. Inflammation is a protective mechanism, but when it becomes chronic, it works against you. What castor oil and baking soda do, together, is remove the obstacles. They reduce the inflammatory signal. They rebalance the environment. They give your tissue the conditions it needs to do what it was always trying to do: heal itself. 2 ingredients, 10 minutes. Try it for 2 weeks and pay attention to what your body tells you. And if you found this valuable, share it with someone who needs it. Because this kind of information doesn't always find the people who need it most.